service for the week, so I'm kind of taking care of Lindsay's.
What was the name again? I'm sorry.
Dr. Glick.
Glick.
Yes. I understand you were able to talk to our kidney doctors a little bit earlier.
She didn't really know anything. She said she was just like checking on her, and then she was going to go look at the test results and find out some things, but she didn't really have anything to tell me.
And they're just getting involved today, so they haven't been as
right. Yeah. Just coming into her rounds with Katie right now.
I would say the biggest thing that's going on is right now, obviously she's on a lot of oxygen, and that's still been going on for the last...
Is it 90% now?
90% now.
What does the 60 mean? Because before she was on 60%, so...
60 over here.
I didn't know how to read that. There was 90 on one place and 60 in another.
The 60 I wouldn't pay attention to. That's called a ramp. That's how fast it gets up to a...
Okay.
Well, yeah, that's...
So the 90% is how much she's... Okay.
Oxygen. Yeah, and that's got a little O2 above it. And that's really a number that's concerning because it shows that she's still needing a lot of support. We like to get people down below 60, 70% just because there are some side effects from oxygen. But right now we tried to bring her down to 80% today and she couldn't handle it. Her oxygen levels dropped. So she still is needing that high level of oxygen, which is not good long term.
Okay. Well, she had x-rays, and what did they find out with the x-rays?
Nothing new.
No improvement at all.
Yeah, they said mild increase actually. So,
an increase in the infection?
Increase in the amount of inflammation. So not necessarily, I was thinking at this point we're almost not even dealing with the virus causing the damage as we are the immune system causing the damage.
Could you break that down and dumb it down a little bit?
Yeah, so the virus, obviously COVID gets into the body and causes some damage. The reason that people start to have these bad symptoms a week or so after they actually test positive for COVID is because what really hurts them is the immune system's reaction to the virus. The immune system, say it's kind of like detectives that are searching for somebody, and they go into overdrive and they start banging down doors of things that maybe they shouldn't even be looking into. And that's the immune system kind of attacking.
Overreaction?
Yeah, it's overreaction of the immune system.
Okay, so does she still have COVID?
She still has COVID, yes. Yeah. But she's in the phase now where we're worried more about the immune system and trying to tamper that down with steroids and other medicines.
And you're not able to be successful with that?
Right now, no. Yeah. And it's a frustrating day-by-day process. So I can't tell you that tomorrow won't be a little bit better, or it might be a little bit worse. It's slow progress, and you've probably seen that with how long she's been here.
I haven't seen any progress. That's the problem. I mean, there's just no...
That's the frustrating thing.
I want to see some kind of progress, and there hasn't been any.
And then today, and I think a little bit yesterday, we started seeing signs that her kidneys were not tolerating being so sick.
And being so dry, because of her lungs needing to be dry.
Right, so it's a give and take. The kidneys, I would say, are probably our most sensitive organ. So either too dry, too wet, not enough oxygen, too much oxygen. They like a really narrow window. And there, like you said, there's multiple things. Being dry, having low oxygen levels.
I'm in stage 3.
Okay, yeah, so you know.
So I think there's it runs in my family.
Yeah.
And
so that's why the kidney doctors got involved, is because they're going to help us try to figure out, one, what's the cause, and so we're giving her a little bit of fluid back today, and two, what can we do about it, whether that's fluid or medicines or time often is the biggest healer we use. So we're still kind of in the discovery phase when it comes to the kidneys, but I was not excited when I saw those numbers this morning showing that her kidneys are starting to take a little bit of a hit.
Is there anything that's hopeful?
Unfortunately, a lot of the the care that we know for COVID is steroids and letting your time. If we can kind of help her body heal itself by supporting her with a ventilator, giving her steroids, preventing kidney problems, heart problems. There's no magic medicine, unfortunately.
There's no other treatment aside from the steroids at this point?
There's a couple other immune treatments. Let me take a look real quick and see. She has not been getting those because of her inflammatory markers weren't high enough. So there's certain criteria to people we know those medicines work in, and people we know they don't work in. And she, based on the markers that we've drawn, is not somebody those would work in. So really, it's steroids are the thing that is going to be.
Just out of desperation.
Yeah.
I have a friend who mentioned this, and I have no idea about it. I haven't looked into it at all. But she said a doctor had tried Viagra on one of his patients because of it opening up the
pulmonary vasculature, probably.
Okay.
The blood vessels in the lungs.
Yeah.
Yeah. That is, so yes, Viagra or sildenafil is the name. It's something that we do use with patients with pulmonary high blood pressure.
Could it help with COVID?
We've had studies, it doesn't really help with COVID.
It doesn't.
No.
Well, it was just worth a shot.
Yeah. No, it's a good thing you bring up because the mechanism does sound like it would help. Right now at her point, her lungs are stiff, what we call fibrotic. So there's kind of scar tissue all throughout the lungs, and that's her big problem. So it's not necessarily the blood vessels.
Is there nothing that can be done about that?
Time, unfortunately. I mean, there's not much that we have to do.
Nothing can heal that?
Not things that we can do. The body has ways to try to heal. But
we got an army praying for her.
Yeah. That I think is probably the best thing right now, because there's kind of don't have any medicines that we know of from this 2 years of studies that can help treat her right now. It's going to be what we call supportive care, so helping her stay alive and help God in time try to heal. And I'm worried with those kidney numbers going up. I'm worried about what that might suggest. But something that we see towards as COVID patients get sicker and sicker, their kidneys take a hit, and often that means either we talk about dialysis or
oh Lord.
Yeah.
Or some families choose to say no dialysis, and then we'll go kind of the comfort care route and talk about making her comfortable instead of trying to prolong her life. I don't think we're there yet. I don't want to have that conversation yet, and we're still pushing. But unfortunately, that's some patients who start to have kidney problems like this end up in those conversations. Don't let that happen. Please don't let that happen.
We're going to do everything we can for her.
I know you do. Thank you.
What other questions can I answer for you?
I don't even know what to ask.
It's okay.
But if there's anything you can think of that I should ask or should know, please tell me. My sister will scold me later if I. Why didn't you ask this?
Yeah. We'll be talking every day.
Okay.
So I think we'll keep you updated.
Okay.
Right? Even if you're not able to come in, I can give you a call. We can talk.
I will
about
come every day.
Okay. We can talk about what
Come hell or
updates
high
are.
water, I will come in every day.
Okay.
Okay.
Hang in there. She's still fighting.
I know she is. She's as stubborn as her
She
mother.
had to fight with her a little bit this morning. She was awake and kicking. So.
Yeah.
Okay.
Yeah.
If you can knock her out when you move her, as much as possible.
Yeah.
If you can talk to her, whenever you manipulate her, in a calm voice and tell her that you got her, that
Yeah.
call her by her name, Katie, and just if you can manage to talk to her, that I think calms her and helps her a lot. She doesn't know where she's at.
Yeah. It's good to know that now.
She's
and-
very
And we
confused.
have some more extra medicine to help keep her calm.
But
This
talk.
morning was a little bit wild.
Talking to her helps her a lot. I know it does. And if you can spread the word and let everybody know that, I
I
mean,
sure will.
it really
Yeah.
does help her a lot. Because, I mean, can I write that on there? Could you write that on there and talk to her? Talk
Okay.
to her.
Yeah.
Because she's a real communicator. We're talkers. We're huggers. We're communicators.
Got it.
And it's really important. Thank you.
Yeah. We'll do.
Okay.
All right.
Okay. Thank
Hang in
you.
there.
Thank
I'll
you.
talk to you tomorrow.
Okay. Thank you, doctor.
Thank you.